This presentation title is Hoteria Mentality, a social media strategy to clap back at COVID-19. If I'm missing it, with that in mind, okay, and so just to, I'm not going to get into the abstract, so I'll let you guys jump into the presentation now.
Great. Good morning, everyone. Thank you for joining us. This is Hoteria Mentality, a social media strategy to clap back at COVID-19. Next slide, please. I am Alejandro Chavez. I work at Ultimate Health Services. I'm a supervisor there for Project Empowerment, which is a state Office of AIDS grant that really focuses on PrEP, PEP, HIV testing, access into care, and a special training component that's really geared towards training all of our medical providers on everything PrEP and PEP related. And this is my co-facilitator.
Good morning, everyone. My name is Charlie de Lira-Zepeda. I'm the supervisor for the Vulnerable Populations Grant with DHSP, which is a collaboration project with the Wall of Memorias. So we focus on leadership development for queer youth 15 to 29.
Next slide, please. So I'm going to do a quick presentation overview and what we're going to talk about. We all know that COVID had a huge impact on all of our service delivery, especially being grant funded. We'll talk about the strategies we took and our engagement methods. We're going to talk about some of our live IG sessions and our website, and we're also going to talk about how what our findings were, what we're calling our clap back to COVID-19. Next slide, please. So as we know, in March of 2020, life changed completely. COVID-19 changed all of our in-person healthcare practices, thus stopping HIV testing, people coming in for PrEP, just all of our HIV prevention services as a whole stopped. So we needed to come up with a way to be able to deliver our deliverables for all of our grants. And what we did was thought of like, what are our objectives? And so really it was to continue engagement, to continue retention, and to recruit new people using a completely different platform that we weren't used to using. We created a social media strategy to maintain those activities going. Again, because it was recommended that all HIV testing services, prevention services were kind of put at a halt, we needed to do something to make sure that we were still connecting and helping the community. We decided to target Latinx and Black populations living in the East LA area, but the community at large, with an emphasis on the LGBT communities. Thus, Hoteria, or queer mentality, was born. The name was chosen by the staff and a community advisory board, just based on what we thought was a really empowering name for the program. Next slide.
So now that we had this social media platform, we had to think of a creative way to keep our followers engaged. So we came up with a live session. So as of today, we've actually done 42 live sessions. However, today we're only going to focus on those that had a really big impact and the most views. So we first wanted to start off with COVID. There was a lot of questions about COVID, unanswered questions. People were nervous. So we invited one of our registered nurses from Ultimate to really give followers opportunity to ask questions that normally wouldn't be able to ask questions. So that was our quarantine and chill. We also wanted to focus on people's mental health. During this time, a lot of people were nervous, they were depressed. So we brought in a mental health clinician to really ease those questions, those anxieties. And again, we had a scope of work that we had to do. So right now, if you look at YouTube videos, makeup tutorials are very popular. So we thought one of our co-workers, he's a makeup artist. So he thought, why not do a makeup tutorial while at the same time talking about HIV 101? And so that got 194 views. Next slide, please. And so again, we wanted to keep in mind during quarantine, there's a lot of drug use, a lot of domestic abuse going on. So once again, we invited professionals. We had a mental health clinician for our drug use awareness, and we also had a domestic abuse counselor to really focus on the issue at hand and also to provide services. Around the same time, a lot of people were unemployed, but at the same time, people were going back to work. So we brought in a professional development person to help with polishing resumes. And you got to remember, a lot of people that were going back to work, a lot of these interviews were virtual. So now things were different. And so we really brought someone in to coach us and lead us to the next new normal. Next slide, please.
You'll see that one of the things that we tried to really do after those initial sessions was really reach out to the community and use our consumer advisory boards to come up with topics that were really relevant to what was going on outside of COVID, just regular everyday lives. One of the topics that was brought up was, as you can see in the first picture, it was toxic masculinity. This was a 3-part series that we were able to do, and we were able to talk about what masculinity was, the traits that make it become toxic or can make it become toxic. And it was a very, very successful series for us. As you can see, we almost had 1,000 views on that alone. Moving forward, we started noticing that our follower base was huge in the sense of we had all genders joining us. We had a large women following. And so we decided to do a session specifically on women's health, which garnered about 26 views. Which was really successful. We didn't know if it was going to be that successful, and this blew us out of the water, just thinking about how many women we had really actually following us and asking us questions live. It was a great way to have people ask from home and in a way that didn't feel judgmental. It was just coming up in a chat, and so it was it was just eye-opening to see all of these just ideas and thoughts. This last session was our Sex, Love and Lust, Understanding and Trust session, which was an acronym for SLUT. We wanted to make sure that we took away the negative aspect of what that word holds and kind of break it up into different sessions. This session was huge. As you can see, almost 2,500 views for just a 2-part series on this session alone. Next slide. We also wanted to make sure, as our following grew and as we saw all of our community members that were participating in what we were doing, we wanted to highlight these individuals. And so these are 3 of the people we've highlighted. We have a feature Friday every Friday. And the first picture is one of our cab members who graduated this year. And we know graduations were completely different this year. People weren't having ceremonies, pictures weren't being taken. And so this member of ours asked us if we would be able to take some pictures of him because he wasn't able to do so. So we were able to provide a photographer and a safe space for us to take those pictures for him and highlight him on our Joteria page. Our second picture in the middle is a mariachi, part of Arcoiris Mariachi, which is the first queer mariachi in the world. And he's also a makeup artist, as you can see by his amazing skills. And so we were able to also highlight him as one of our cab members. The last picture is Calypso. And if you've ever seen the show Legendary, which is on HBO Max, she was a contestant on this show. And it's basically a house ball scene. And they were house balls competing against each other, and her house won. So she's been to multiple of our workshops, has been able to perform at some of our shows. And so we wanted to really highlight all of the community members that were doing really great in the community. Next slide, please.
So as we know, we had a really important election. So we really wanted to use our platform to really encourage voting. For a lot of our followers, this was the first time voting. So we actually invited our government affairs department to join us in a live session. And in the live session, we talked about voting, the ballot, we even talked about local measures. And we also wanted to showcase, so we had our staff take pictures with the balloons that promote voting throughout LA County. Next slide, please.
We this was started off as a really small project. And again, we work for Ultimate Health Services, which kind of caught wind of what we were doing on our Instagram page. And they really thought that the work that we were doing was great. So they invited us to take over the Ultimate Health Services Instagram page, which for us was huge. It really increased our volume just in the world with the following, the base that they had. And we were able to do our World AIDS Day event by doing a takeover of their website. So we started off with, it was a full day regimen talking about testing, PrEP and PEP. We discussed U equals U. We discussed living positively, and we had someone share their testimonial. And at the end of the night, we did a Zoom moment of remembrance. Again, World AIDS Day changed this year. You know, we're used to gathering for these events. And so we wanted to still have something that people could go to and share those moments. So that was an amazing outcome that we found. just being able to collaborate with our agency as a whole from starting from such a small little place. Next slide, please. We were able to come up with various PrEP campaigns, which have done very successfully. I'd like to talk about all three of them. Our first campaign, which is the one with the condom, was called Certified Freak 7 Days a Week. And yes, we did take the lyric from Cardi B and Megan Thee Stallion's WAP song. And what we did was we posted a picture for a week, one picture a day for a week, on normalizing PrEP. So the campaign started with showing a picture of a PrEP pill and a computer, a keyboard. So just kind of normalizing taking it. The next day was a cup of coffee. The third day was a book. Our Friday ended at this picture, which was condoms, lube, and our PrEP pill. As you can see, it reached about 1,400 individuals, which was amazing. Our second campaign was couples who play together, PrEP together. And so really it was a campaign to show that we wanted to normalize sexual activity, and that couples still do take PrEP. As you can see, it rendered about 700 views. And the last campaign was a TikTok video, which went through different social media streams, as you can see, and it garnered about 7,500. Next slide.
So because of COVID, we weren't able to do in-person workshops. So we transitioned our interventions into virtual. So here we have our workshops from DHSP and our CDC contracts. And as of March, we had 203 participants in our virtual workshops. Next slide, please.
As you can see at the very beginning of the COVID-19, our numbers for HIV testing were really low. We really started focusing on advertising our HIV testing. Even though there was a recommendation to stop all in-person services, we decided that we would make the safest possible way for people to come in and get HIV tested. As you can see, our numbers in July peaked at 88 and have since then dropped slightly, but not the same as it was at the very beginning of our COVID-19 quarantine. Next slide. We really just wanted to share that by being able to create this platform, we've been able to do things that we never tried before. And it allowed us to share our services at the comfort of people's home and in safety of people's home. This was really instrumental for just finding and navigating a lot of different people into services, whether it was PrEP services, where there was linkage into care, or HIV testing services. So thank you for everyone. And next slide.
So here you can see our social media handles for Instagram and Facebook. Please, we would love you can follow us, or if it was easy for you to just simply scan the QR code and it'll lead you directly to our accounts.
Next slide,
please.
And just a quick thank you, Charlie, thank you, and to our supervisors and support to thank you as well. And for all of you watching, thank you so much for participating and watching our slide.
Hi, thank you very much. Great presentation. It's always great to hear people very in touch with the community and their needs. I think we have time for one question, and I already found one actually. So somebody was asking, although the target catchment area was people within East LA, did you find any global reach or reach outside of East LA in terms of participation?
Yes, absolutely. So we actually had someone from Florida reach out to us and asking about, after seeing one of our PrEP campaigns, asked us about PrEP. And so we were able to actually navigate and find them a PrEP location in Florida where they were at. So yes, although it hasn't gone global yet, it has gone national in a sense, reaching all the way across to Florida. So yeah, it's been amazing.
Yeah, that's wonderful.
And also for our virtual interventions, because we did promote on our social media platform, we had a one participant from Chicago. So although he was in LA County, he was still able to benefit from our workshop.
Okay. And so I just have one very quick question. For your needs assessments, when you're trying to determine content for the participants, is a lot of that coming from feedback from social media, or are there other assessment tools you're using?
So yes, it's usually us asking our either community advisory boards or youth advisory boards. And yes, we do post questions out there for content. If it's just anything they'd really want to share with us. We've also done work with other community organizations and just kind of done shared screen live sessions talking about different content and how it links together. So we've been able to do it in very various platforms.
Excellent, thank you. All right, thank you so much for sharing your awesome work. I'm going to jump over to